Okay, shall we get started? All right. Well, hello everybody, and I want to thank everybody for coming today. And as we begin, I want us to hold foremost in our mind that today is International Overdose Awareness Day. So as we know, around the world, but especially here in the United States right now, we are facing an epidemic of overdoses from opioids. This is an issue that around the world has been treated in different kinds of more public health kinds of ways, but in the U.S. we have treated it more as a criminal offense of people using drugs. When we have an epidemic such as this, when overdose takes over from car accidents as the #1 leading cause of accidental deaths in the United States, it's time to do something different than we've been doing. So the bill that we're talking about today is AB 186, and what it does is simply create a pilot program where we set up 8 different counties to make them permissive for them in their own municipalities to be able to hold hearings and to decide if they'd like to have safe consumption sites as one more tool in the toolbox to deal with this issue. Currently, and we're talking about people who are either oftentimes homeless or near homelessness. These are people who are already using IV drugs on the streets, on the beaches, in playgrounds, in neighborhoods. And rather than judging them and continuing to lock people up in jail, lose lives, our public safety responders being called out repeatedly. There was one council member in Ohio who said, do we even have to respond anymore to overdoses just because it's becoming so epidemic? So these sites, as we found around the world, increase the amount of people who get into treatment. They increase the amount of people who stay clean. They decrease the amount of people who are contracting and passing on HIV, hepatitis, and those kinds of things. We also know that health impacts go up when people are able to get help earlier, because a lot of these folks are also dealing with issues of homelessness, perhaps human trafficking, abuse. And when you're coming in every day to a facility where there is a friendly medical professional there, and we also know that in these facilities around the world, not one person has died of an overdose. That we know that these things work to get people into treatment to save lives. And we know that for every life lost to overdose or somebody living on the streets, there's a whole family and a whole network behind them that is also suffering with this. So again, we don't think this is for everybody, but we think on a continuum of care that we should stop treating addiction as a criminal issue, and we should really start dealing with it in a more humane and public health issue. Let's get needles out of playgrounds. Let's save some people's lives and get people into treatment. With me here today, the first one to speak, we have Senator Scott Wiener from San Francisco.
Thank you. Good morning. And I first want to thank Assemblymember Eggman for her extraordinary leadership on this bill. She has not given up and keeps going, and has, I think, moved this bill further than a lot of people thought she'd be able to do so. So thank you, Assemblymember. I am a passionate supporter of safe injection sites, of supervised injection sites where we can give people who are addicted to drugs an opportunity to consume in a safe way and in a way where we can help get them into services, keep them healthy, and we hope get them into recovery, into housing, and whatever services they need to be stable. We have a real crisis on our hands. We know about the national opioid epidemic, nationally and in California. I can speak most personally about San Francisco, where I've lived for the last 20 years. And I have seen the absolute explosion of public injecting of heroin, of other drugs. And in San Francisco, you can see it on the streets. People who are injecting on the streets, we can see it by the syringes that we find on the ground, on the sidewalk, on people's front porches. We had to actually remove a sandbox in my district, in my neighborhood where I live, because people were actually burying syringes in that sandbox. It is a situation that is unacceptable for the people who are addicted and who are really in a downward death spiral, and it's unacceptable for the communities that are impacted. And the way to address this is not just to toss people in jail for being addicted to drugs. We tried that. We did that for decades here in California and elsewhere, and it was and has been an abysmal failure. It doesn't reduce drug use. It doesn't reduce drug addiction. All it does is put people in an even worse spot. And so criminalizing drug addiction doesn't work. It's a public health issue, and we need to treat it that way. San Francisco has a long history of taking smart public health approaches to, for example, needle exchange, or some of the work we've done around HIV and other infectious diseases. Instead of criminalizing people, we try to get people connected to healthcare, to get people stable. I know that there are people in San Francisco who have told me that they're concerned that there might be a supervised injection site in their neighborhood, or what it's going to mean. It's going to draw people there. It's going to create problems. And to my neighbors who have these concerns, I say, we have a problem right now. People are injecting in our neighborhoods right now. People are leaving syringes in our neighborhoods right now. And I would much rather, and we should all much rather have these folks in a supervised, healthy setting than out on our streets. So this is an important bill. I'm excited that San Francisco will be able to participate, and I look forward to getting it passed. Thank you.
Thank you, Senator Wiener. And again, this is issues around the state. So also with us today, we have Assemblymember Laura Friedman from Southern California.
Thank you. I would also like to praise Assemblymember Eggman for her role and her leadership in bringing this forward. This is a tough issue. This is an issue that is difficult to address. It's an issue people don't want to talk about. And she's taken a really amazing position to be able to be the one to lead this effort to move this forward. So we've been dealing with this crisis, and it really is a crisis for a number of years now in America. And there's a few things that we know. We know that the current approach of incarceration doesn't work. We know that people don't come out of prison after their experience reformed, well, and able to function. We know quite the opposite, that people who go in as addicts take up a lot of resources that aren't being given to really give them the skills and the ability to live cleanly and be productive. But they come out much more hardened and much more likely to reoffend with lots of other types of criminal offenses. We know that we have people on our streets and in our playgrounds doing drugs, causing another public health crisis of people being afraid to bring their kids out on the sidewalks and in the parks because they're afraid of syringes. We know that other countries that have done this have had good success. We know that these types of programs do not lead people into drug use. Nobody wakes up in the morning and says that they're going to go and start using drugs because there's a safe injection site in their community. We know that people that are using these drugs are subject to higher rates of death, not just from the drugs, but from lack of medical care, from other illnesses that they're contracted on the streets. We know that getting them into a place that they trust can get them access to doctors that can treat not just their primary addiction, but also all of the secondary effects and medical effects of living on the streets. We know that in Los Angeles, where I represent, that the homeless population is exploding, and that one of the biggest quality of life issues for everyone in Los Angeles has to do with the number of people on the streets. People are heartbroken to see their neighbors, their friends, people in their community without a home. They also find that their own ability to enjoy public spaces has been severely compromised by the amount of people that are living on the streets. So this affects everybody. Setting up these safe injection sites is really a step that we need to take. We need to take it to deal with addiction as a medical problem and not a criminal offense. We need it because we know that a lot of the people who will use these services are people who desperately want to get clean, who desperately want to get well and return to society. And this will be a great first step in getting them into a place where they can become more trustworthy of people that they're in contact with, become familiar with people who can then offer them services to really get the help that they want and that they need. I think that this is an essential bill. This is a bill that we have to fight for because it's not going to be easy. There's a lot of misunderstanding, there's a lot of fear, there's a lot of anger towards drug addicts and towards our homeless population. We need to turn that energy into compassion. We need to turn it into action. We have to have the bravery to push back against people who don't understand the breadth of this problem, who don't understand that the people that are going to be served are people who are people's children, people's neighbors, people's parents. We need to have the bravery to look inside ourselves and push back and say we want to get these people help. So again, I want to thank Assemblymember Eggman for bringing this forward. I want to thank everyone who's come today to testify and share their experiences. And I hope that anybody watching this will join us, will send an email and send their support, and really try to be the ones to go out in their communities to spread the word about how important it is that we start to truly address the roots of our addiction problems and to give people the tools that they need to be successful. Thank you.
Thank you, and I appreciate my colleagues saying nice things about me, but when I introduced this bill last year, we couldn't even get a vote in the first committee we went to. This year when I went, I said, since we haven't passed this, 3,600 Californians have died of overdose. That's unacceptable. There's no, I don't think there's bravery in just trying to do the right thing, and that's what we're here to do today. People might know during the 80s and 90s, I'm a social worker by training. I worked in addictions. I saw the epidemic go from heroin to crack cocaine to methamphetamine, and now we're back to heroin and opioids again. And this affects real families. So also with us here today, and like a lot of things, we start bills and then people just start coming to us to say thank you, and I have a story and I have an experience. So also with us today, we have Laura Schrader, who lost her daughter some years back, to share her story with you.
My daughter Sammy read something to me from Narcotics Anonymous pamphlet years ago that said, insanity is repeating the same mistakes and expecting different answers. Sammy was my oldest child. She was bright, talented, and beautiful. She graduated high school at 17, worked to help put herself through college, and attended art school. She made friends easily, loved her family, and at 25 years old, Sammy died of an accidental heroin overdose. I was taught early that drugs are bad and people that use drugs are bad. But I knew in my heart that my daughter was not bad. I had watched Sammy struggle for years with her substance dependency as she participated in many detox and rehab facilities. I watched her be shamed and stigmatized as she desperately tried to find help, only to be turned down, turned away, or made jump through unreachable hoops. I held her when she cried because she felt like a loser. She felt like a failure. She just couldn't get better. Sammy wanted nothing more than to be seen for who she was, not the negative labels that we put on people with substance use. On August 31st in 2013, I attended a march for International Overdose Awareness Day. At first, I was really reluctant to go. But in the end, that walk changed me. I was met with love, compassion, and absolutely no judgment for me or my daughter. I heard new concepts that were completely foreign to me. Needle exchange, harm reduction, naloxone, safe consumption. I had no idea. These ideas made me wonder, had I been making the same mistakes and expecting a different result? I began reading every argument I could find, for and against. I visited harm reduction facilities. I talked to anyone that would listen. After examining the evidence, I realized harm reduction and safe consumption just makes sense. My research taught me that many other countries around the world have been running safe consumption facilities for decades. Consumption sites provide much needed medical and mental health services to people who would otherwise not have access. I learned participants are much more likely to seek treatment and enter recovery. These sites actually reduce crime in the surrounding neighborhoods, reduce discarded needles, reduce the spread of HIV and hepatitis C. But the most moving fact to me, I learned that there has never been a single overdose death in a safe consumption site. Not one. If safe consumption sites were available in 2013, it is very likely that my daughter and many others like her would still be alive. Sammy's death has taught me how precious life is. It has opened my mind. I'm now a board member for harm reduction services in Sacramento. I advocate for harm reduction and overdose education. I train others to use the life-saving drug naloxone. My quest for knowledge and understanding has led me to conclude that what I was taught, what I was doing, what we are doing in this country is not working. We continue to make the same mistakes and expect different results. Substance use disorder is a health issue and should be treated as such. Safe consumption is a health service that should be offered in this state and across the nation. If you just examine the overwhelming evidence as I did, I am sure you will come to the same conclusion. Safe consumption makes sense and it saves lives. Thank you.
So you can see this comes from multiple perspectives. You have policymakers, you have family members, and this is evidence and research based. The American Medical Association has now come out and said they are in favor of these kinds of sites. Most every addiction specialist support these kinds of programs. The research supports it. And with us now we have Alex Kroll, who's a PhD researcher who has been doing work on this area.
Thank you. It's bad enough that Laura and her family has had to suffer the consequences of drug use in really the hardest way. But as has been mentioned up here, at this point, 500,000 Americans have died of overdose just since 2000. I've been doing research. I'm an epidemiologist from San Francisco, do research at a nonprofit institute called RTI International. And I've been conducting research on drug use and overdose in California since 1993. Back then, we thought it was really a big problem. It has gotten so much worse. It really has. So what we've been doing is trying to figure out what the research is. Much like Laura here, we also had to do some research and look around the country, but also look to other countries. And as has been stated here, it is clear that whatever it is we're doing now is clearly not enough. And so what we need are new solutions. But in the case of supervised consumption sites, they're new solutions to us here in the United States, but they're scientifically proven solutions from 10 or 11 other countries around the world. The research is quite clear on this. And so we're on a solid ground here in terms of an evidence-based innovation that has intervention that's worked elsewhere. And it's just, frankly, a matter of figuring out how will that work here, and how can we get the benefits that have so clearly been shown to work and happen elsewhere, in Europe, in Australia, and in Canada. The research shows clearly you have reduced numbers of HIV infections, viral hepatitis, soft tissue infections, overdose, and also clearly people, actually this is one of the biggest ways to get people into drug treatment, into substance use treatment. And so, for example, the place up in Vancouver that's been around since 2003, they facilitate about 500-600 people getting into drug treatment every year. And so this is a way, to get people into substance use treatment. And while that is great for the people that do get into drug treatment, it's also saving the lives of those who are not quite there to the point that they want to go to drug treatment, yeah. And so it's really accomplishing both of those goals of keeping everybody safe while they're in the midst of substance use, but also being a conduit for people to get into drug treatment. The other thing that has been clear from the research, especially from Australia, but also in Canada, has been that this doesn't just benefit the people who are using these sites. It also benefits the community. You have less 911 calls, and that frees up ambulances to do other work. That's quite a costly piece right there. It also reduces the number of needles in the streets. It reduces the number of people who use drugs in the streets. It reduces crime. All of these benefits come. And so we did a research paper that was published in the Journal of Drug Issues just last winter that said, okay, well, what would happen if we placed one of these sites in a place like San Francisco? What would be the costs of this, and what would be the reductions from this? And what we found was that sure, it would cost, it would cost money to do this, but at the end of the day, what would happen is the city would save $3.5 million annually. That's on top of the cost. So they would save $3.5 million from the reductions in HIV, from reductions in hepatitis C, from people getting the drug treatment, from overdoses. All of these things would result in savings. So not only do we have a new innovative research piece here, but we know exactly what's happened in other countries. It's likely to happen here. It will save lives. It will help the community, and it will actually save money for the places that try this as well. This is why the American Medical Association has already thrown their support behind this, and other places such as the Massachusetts Medical Society, and even the surgeon, the potential incoming Surgeon General, has stated that he's interested in these sites getting piloted. So this is a strong evidence base for these types of services. Thank you.
And then our final speaker, and we'll take some questions, comes from the Drug Policy Alliance, Laura Thomas, and the Drug Policy Alliance has been doing this kind of work around the country to try to get good policies into place so that we can treat with addiction. This is Laura.
Thank you, Assemblymember. I'm Laura Thomas. I'm the Interim State Director for the Drug Policy Alliance here in California, and I also want to thank Assemblymember Eggman for her strong and dogged commitment to moving this issue and this bill forward. It's been a pleasure to work with her and her staff. I thank Assemblymember Friedman for her support, and particularly State Senator Scott Wiener, who's my senator from San Francisco, for standing up for what he knows San Francisco needs. In San Francisco, I've been fortunate enough to be a part of the process where we, the Board of Supervisors and the mayor, have created a task force that is developing recommendations and will recommend that San Francisco should open these sites. And AB 186 would give us the ability as a county to move forward and act on those recommendations and help take care of the people and the communities in San Francisco that we have. The Drug Policy Alliance is proud and honored to co-sponsor this legislation along with a number of other statewide organizations, the California Society of Addiction Medicine, California Association of Alcohol and Drug Program Executives, Tarzana Treatment Center, the Harm Reduction Coalition, and Project Inform. And we all came together from treatment, from HIV, hepatitis, harm reduction to support this issue because of the impact that it can have across all of those different domains, linking people to treatment, addressing HIV and Hep C. But today is International Overdose Awareness Day, and as has been referenced, accidental drug overdose is now the leading cause of accidental death in the United States. That's also true in California as well. At this point, there is one overdose death in this country every year who worked for Glide Foundation in San Francisco. Since we came up here to advocate for that bill, he suffered a serious injury, and in the process of treating that, relapsed, and he passed away of an overdose. So people here in this building, people who work here, people who come up here to advocate, to lobby, and people that those of us who are here love are vulnerable to overdoses, whether we realize it or not. And from a Drug Policy Alliance perspective, We believe that treatment should be more accessible, that naloxone, which instantly reverses an opiate overdose, should be more accessible. And we thank the California legislature for the work that they have done to make it more accessible. And in particular, we think that we need supervised consumption services, and legislation like AB 186 is part of how we make that possible, so that we won't be back here again next year for International Overdose Awareness Day, again talking about the number of people who have passed away in this state and the families who have lost loved ones in that time. Thank you.
So again, thank you to everybody for being here. Thanks to my colleagues and the people who have come to support this today. Again, this is International Overdose Awareness Day. We want to take a concrete step this year in being able to reduce the amounts of deaths from overdose in the state of California, get people into treatment, behave in a compassionate way, and saving lives and saving money. And we'll be glad to take some questions at this time.
I guess just first I was wondering if you could update me on like where the bill is right now and what's left in terms of the process for this
Yes.
year.
So the bill currently, and it is a pilot program that will expire in 2022. The bill currently includes, as part of the pilot, and again, these were counties who already had a high degree of overdose and IV drug use, and they were part of a previous pilot with naloxone. So that's how the counties were identified, and they are Alameda, Fresno, Humboldt, Los Angeles, Mendocino, San Francisco, San Joaquin, and Santa Cruz. The bill has now made it all the way through the Assembly. It has made it through both policy committees on the Senate side. It is now on the Senate floor. Senator Wiener will present it there, and then from there, hopefully we get that passed this week or next, and then we go to the governor's desk.
Is there anything in the bill that addresses law enforcement? Because the people, especially going into facilities, will be in possession, and if law enforcement is targeting these safe clinics, then it seems like it would be a deterrent for people wanting to go there for treatment.
Yeah, and that is, so, the question about what about law enforcement? So I will say in the countries that have them, law enforcement works collaboratively with the programs, because otherwise you have people using on the streets and they'll say, hey, do you know there's a safe place where you can go to use? In these communities, I mean, I don't know about others, but my police department and they have a lot more important things to do, to go after the distributors, to go after people who are trafficking through gangs, than to get the individual user. And again, any county that these are started in or the pilot goes through, it would have to have a public process where law enforcement would be engaged and involved with the setting up of the individual clinics.
Obviously, the pilot is available to those counties you mentioned. Have there been any that have expressed interest already in opening a facility, like, that are already planning to move forward?
I would say
to the
San
law
Francisco is
passed,
probably the
anything like
closest. Some of the northern counties as well have expressed some interest. Everyone knows it's an issue and are looking at it. Los Angeles is probably the biggest county, and we've got the charts up here from California overdose deaths. So you can see the dark red is where they are. I mean, they're up. So Los Angeles, the Board of Supervisors, I don't know that they'll be able to get a full vote, but they also have a task force looking at this, as Ms. Friedman said. And again, I think the housing crisis has helped exasperate this, because people who maybe were hanging on and being able to use, when you find yourself on the streets, it becomes much more difficult to get clean and to stay clean. And we know with the cost of housing going up, that just kind of adds to it. So I know Los Angeles County is looking at it as well. So people are in different states of the process. All right, there's no more questions. We'll just say thank you all, and we'll be available afterwards as well. Thank you very much.